Now, we have any more amendments on this bill? Okay. Let's move to the S-380 Rural Obstetrics Readiness Act. I thank Senators Collins and Hassan for their leadership in this legislation. The bill aims to help rural practitioners prepare for and manage obstetric emergencies. This legislation further facilitates access to care for mothers residing in rural communities by supporting the improved delivery of emergency obstetric services during pregnancy, labor, delivery, or the postpartum period in areas without dedicated obstetric units. We have a manager's amendment to S-380. I move to adopt in the nature of a substitute and have considered original text for the purpose of further amendments. All in favor, please say aye. Aye. Those opposed, say nay. The ayes have it. The motion is agreed to. Do any members wish to speak on the bill? Surprise, surprise, Hassan does.
I want to thank you, Mr. Chairman and Ranking Member Sanders, not only for this markup, but for the work that your teams helped us do on Senate Bill 380, the Rural Obstetrics Readiness Act. I want to thank Senator Collins as well for her leadership. Across our country, we are seeing maternal health care deserts as more rural hospitals are struggling to keep their labor and delivery units open. This bill would provide targeted support to help ensure that small rural hospitals, especially those without labor and delivery units or specialists, have the training that they need to respond to an obstetric emergency such as labor and delivery. I appreciate the committee's work on this bill, and while we weren't able to include the purchase of equipment as an allowable activity under today's agreement, I look forward to working with the committee in the future to add that critical use of funds. This is the kind of equipment that some of our hospitals simply cannot afford to purchase at this time. I urge my colleagues today to support this legislation. Thank you.
Anyone else?
Mr. Chairman.
Thank you, Mr. Chairman. First, let me salute Senator Hassan for her leadership on this bipartisan legislation. Our bill will help prepare rural healthcare facilities that do not have a designated labor and delivery unit to respond to obstetric emergencies. Nationwide, more than 2 million women live in a county without a provider offering obstetric care. In Maine, about half of our hospitals do not have dedicated labor and delivery units. We're trying to recruit Senator Marshall to come to Maine to help with that. Rural Mainers have to drive more than 45 minutes to the nearest birthing hospital on average. The bill that we're marking up today will ensure that rural hospitals will be better prepared to handle women experiencing an emergency with their pregnancy, even if that hospital does not have dedicated labor and delivery staff. The grants and training opportunities created by this bill are sorely needed. It seems like every month we learn of another rural hospital in Maine that is giving up its obstetrics unit because of a lack of providers. I ask all of our colleagues to support passage of this legislation. Thank you.
Senator Husted.
Thank you, Mr. Chairman. This bill is necessary for a variety of reasons, but one of the challenges we have in America is with declining birth rates. In general, since 2000, we've had a 11% reduction in this country in births, and in many states it's higher than 25%. And it's acute in rural areas because there are just fewer people having babies, and the economics and the challenges that these hospitals are having are legitimate concerns. And so I just commend the sponsors for bringing this legislation forward. Thank you.
Does anyone else wish to speak? Okay, we will now consider S 5026, the Childhood Diabetes Reduction Act. I thank Senator Sanders for his work on this legislation. Providing transparency to consumers about the food they eat is important to giving them the tools to make their own health decisions. I have long called on the NIH to increase focus on nutrition and obesity, including in my 2024 NIH Modernization White Paper. In Louisiana, the Pennington Biomedical Research Center is doing cutting-edge work to improve our understanding of how nutrition affects health. The NIH provisions of the bill strengthens research on food and dietary patterns and the relationship between diet and chronic disease. I'm glad we're able to come to a bipartisan agreement on these issues. While other areas of the bill raise policy and jurisdictional concerns, in the spirit of bipartisanship, I will support it to advance a priority of the rankings member. We have a manager's amendment to S 5026. I move to adopt the manager's amendment in the nature of a substitute and have it considered original text for the purpose of further amendments. All in favor, please say aye. Aye. Opposed, say nay. Ayes have it. Motion agreed to. Do any members wish to speak to the bill? Senator Sanders.
Thank you, Mr. Chairman. I won't repeat what I said at the beginning of the markup. I think everybody understands we have a horrendous diabetes crisis in this country, and that is related to the crisis we have with obesity. Maybe there are a lot of factors involved as to why. Certainly one of them is that the food industry produces a lot of junk food targeted to our kids, resulting in many of our children being overweight, laying the groundwork for diabetes. So what we do here is two things. We require a warning label on sugary drinks that says, quote, Food and Drug Administration warning, drinking beverages with added sugar can contribute to obesity, type 2 diabetes, and tooth decay, not recommended for children, end of quote. Not a radical idea. It's being done by countries all over the world. And secondly, we ban junk food advertising targeted to kids, also not a radical idea, done throughout the world. Thank you, Mr. Chairman.
Senator Paul?
I have an amendment. Are you ready?
No. Anybody else wish to speak to the amendment?
Yes.
To the bill? Senator Collins.
Thank you, Mr. Chairman. While I appreciate the intent of the ranking member to reduce the incidence of diabetes, particularly for our nation's children, I am concerned that his bill will not truly combat diabetes. That's why the diabetes advocacy groups have not taken a position on this bill, but it will have the unintended consequence of making food more expensive for Americans. In addition, I have had many conversations with school nutrition directors who have expressed concerns that when we start getting into mandates that you cannot have full-fat milk in schools or chocolate milk or strawberry milk, that it leads to food waste and it